Hello, and you to Instagram. Hi. Hi. Welcome. Hi, Lil Hutchins. Hi, Jen. Underscore D27. Hello. Bacon Rasher. We're just waiting on many more people to join before I proceed, if you don't mind. So my name is Fritz Oben. I'm actually Belizean, but I work in Trinidad and Tobago as an emergency room physician. I'm actually doing my residency right now in emergency medicine, and that is where I intend to specialize. I am currently also a student in the Masters of Critical Care Medicine at Edinburgh University. So this is my first year, and it is my first experience online. Previously, medical school for me would have been 5 years at the University of the West Indies in Trinidad and Tobago. After that, you are required to do 1 year of internship and also an elective period. I completed my elective period in the UK at King's College. Actually, I was posted to St. Thomas and Guy Hospital, actually, and I did my electives, my 8 weeks electives in surgery under Mr. Atkins. So after your elective period, you are then required to rotate through major departments, the medical department, the surgical department, and the pediatric department. So after rotation, I then decided to settle. I felt more comfortable at the accident and emergency room, and or the emergency department, and that is where I intend to specialize, in the emergency department. So I suspect that as we go along, there will be many questions, and I do understand that a lot of my audience are either medical graduates, medical students, or prospective students into the university. So let me see here if there are any questions so far. So the first question I see here is, what do you think of the MSc Critical Care, the Masters of Critical Care, Masters of Science in Critical Care so far? I think it is a well-structured program, because this is my first online experience. I didn't know what to expect. I think in the beginning there was a little bit of fear, and I had so many questions, but it's been quite exciting, to be honest, because the program is well structured. We started very much on time. Every week we are we are given tasks to complete. We have a case of the week, and you are supported by the program directors, and also you have your colleagues you could turn to. For example, we have a discussion board every week where you're required to participate, and during that discussion board you learn a lot from the different healthcare systems. So it's been quite exciting knowing that there are various different systems around the world, knowing that you could learn from each other, and also the fact that there is immediate feedback from the program director. He's been very, very helpful in giving us feedback weekly, and it's amazing how most of your feedback comes in the form of you get an email, you get updates weekly, and you get also your modules coming through your email. Say, for example, you miss class, they will find a way to send you these modules via email. So it's been very, very exciting in the past 3 weeks to be able to learn the information, all the new information, and consolidate that information. So I'm quite excited to be in the program. There is another question here that says, how much time do you spend on your learning every week? Okay, so I break my day into 3 8-hour periods. So at the emergency room, I'm required to work for 8 hours. And then when I get home, rest, relaxation, cleaning, and cooking takes another 8 hours. And then the last of my 8-hour period is shared between learning and planning for the next day. So actual study period, I would say it's about 3 hours compulsory every day, and the remaining 5 hours I may read articles just to review, or probably go online, answer questions on the modules, or see what other students have written on the discussion board, participate in discussions, spend time with the different topics that have been posed on the discussion board. So my actual study time every day is 3 hours. So that's about what, 21 hours a week, roughly. Let me see if there are any more questions. Let's see. How do you deal with stress or exhaustion while working? Wow, it's a very loaded question because of the times we're in. It's a very challenging period, and the adversary we're fighting is a very tough one, and stress and exhaustion is very, very apparent in our work environment at this time. So what I try to do is, one, recognize the fact that I cannot shy away from stress. Recognize the fact that I will get exhausted and take time to take breaks. So I do recognize the fact that the times are challenging. Other people are going through stress as well. And if I feel the exhaustion coming on, I will then take a break during work. So you're allowed a total of an hour break. You could break it down into 15-minute breaks or 30-minute breaks. So it is not Your breaks are not structured. You decide on how you're going to take your breaks. So I take a lot of breaks when needed. Um, I also have a friend, a colleague at work who I talk to when I get very, very stressed. And I make use of my consultants. I make use of the consultants. And we do have psychology experts in the hospital as well if you do need them. So there are so many ways in which we are being catered for. Our mental and physical health is being catered for in the hospital, especially during these times. All right. Let me see other questions. Another question here I see is what is the COVID-19 situation like in Trinidad and Tobago at the moment? So when it started in January, we handled the pandemic much better than many other countries. I think we were rated in the top 5, top 10 countries to have done very well because we closed our borders early. We educated the public very early into washing of hands and wearing of masks, and the government instituted a curfew or a lockdown, and so people adhere to those rules. So we had very few numbers, less than 50 in the beginning. Very, very few numbers. So Trinidad and Tobago is a twin island, the main island being Trinidad and the other island Tobago. So I work in Tobago. The numbers in Tobago were very less, far less than 5. I don't have the current figures as of this week. They release them probably at the end of the week on Fridays. But the testing has surpassed now about 2,000, 3,000 tests done approximately. And we have more than now 1,000 cases, but clearly less than 5,000 positive cases. And the deaths are also they're sad, but it's a minimum of less than I think it's less than 200 at the moment. So compared to the rest of the world, we are not so bad in handling the situation. But it's always sad when people lose their lives to this pandemic. So it's sad times, to be honest. But the government and the medical community in Trinidad and Tobago are doing their very best in handling the pandemic at this moment. The population, I must say, adhere to not almost all the rules actually. So everywhere you go, you wear your mask. There's so many rules now. For example, those when you travel, when on your way to work, you're supposed to put on your mask even in a vehicle where you have other people. And so also family members are required to have their mask on. Say for example, if you're going to work, or if you're going to drop off the kids at the daycare, for example. You're only required not to wear a mask in your own home, right? So yeah, I think we're doing, compared to the rest of the world, we're doing very well in handling the pandemic. Another question is, was it difficult to apply for MSc? No, it wasn't. It wasn't difficult at all. The most difficult aspect of the application process was actually making up my mind in which of the programs I would like to apply. I did not know that there were so many online programs. So when I was looking for a program, I knew I wanted to do critical care. But I did not think they would have critical care an online program in critical care medicine. So another option was to do infectious disease, which I know I would get some form of critical care in it. But when I actually went online and I saw the different programs that they had online, I was just mesmerized, because now the problem was trying to choose which one I would like to specialize in, So I was quite excited. And the process of application itself was very easy. They got back to me in a timely manner. I was able to follow exactly the process. For example, creating a login name and creating a password. All those things were done in the first week. I was able to log on. I was able to send in all my documents. The turnaround period for approval was almost between, I think, 2 to 3 weeks. I got an immediate response after all my documents were looked at. And it was quite an easy process. Like I explained before, I was very fearful because I didn't know what to expect in an online program. But as I continued applying or through the process, things became a little bit easier, because I did have help. Every time you asked for help, you got it almost immediately, the very next day. And the time difference wasn't a problem, because British Standard Time, 5 hours ahead. So by the time I woke up in the morning, I got a response. I was able to go about my daily activity, get any documents that were asked of me, and send them back in a timely manner. And by the end of the day, I will get a response back from the university. So that kind of encouraged me to move on and continue the process in terms of my application. So it was a very smooth process, and didn't have any difficulties at all. Let me see if there are any more questions. Yes, a question here. Do you have any advice for newly qualified doctors dealing with COVID-19? Wow, that's a very, very good question. The most important advice I would give any new graduate is to practice self-care. And it's important to recognize when you're getting stressed, because the temptation is to immediately get onto the clinical setting. You want to work hard. You want to be the go-to person for everything. So recognize when you're going too fast and slow down. The second thing I would say is just think of it as an extension to medical school, except that, your teachers this time are the patients, literally. And you should look for a mentor or a friend, because these are challenging times, and we need to accept the challenge, because we need all the help that we can. So this is what we all train for. So I would say be ready to learn, be ready to go the extra mile, be an advocate for the profession and for the patients, and just be there for each other, teamwork, so that's the advice I would give any new student. So another question here: do you have any live sessions in the program? Absolutely. We have there is a structured live session every Tuesday at 7 p.m. British Standard Time, and that is 2 p.m. Here in Trinidad and Tobago. So we have live sessions, and at this time it is being run by the program director, Dr. Nemo, and it's like being in a regular class, because he would ask questions, he would clarify the previous week's work. You are allowed to talk about any issues or questions you have during the live sessions, and the live sessions are recorded. So for those who who don't attend, they could review the live sessions they could review the topic on a later date at their own leisure. And that is one important aspect I like about the program as well. The fact that the modules are stored and you could retrieve them. You could look at them on your smartphone or iPad or tablet at your own leisure at any time. So most of the times I would review some of these sessions while I'm exercising or while I'm cleaning the house. So it's very flexible, and I really do enjoy that aspect of the program. The very first week I was unable to attend the very first live session, but I was able to review it 2 days later. So that was a major plus for me, and I was quite excited. I was quite excited by that. Yeah. Let's see if there are any more questions. I don't see. Are there any more questions? Oh, so I arrived late, sorry. What was the last question in relation to that you just spoke about? Okay, I was talking about it. They asked if in the program I'm in the Masters in Critical Care Medicine, if we do have any live sessions. And I was just saying, yes, we do have live sessions. It's a structured live session every Tuesday at 7 p.m. British Standard Time, which is 2 p.m. in Trinidad and Tobago at the time. The sessions do last anywhere between 30 minutes to an hour 30 minutes. And the sessions are recorded for those students who cannot attend for one reason or the other. They can always review the live session at another date. And I was just sharing with everybody else that I find that very, I actually like that, because the module is such that it's flexible. You could save the session, the recorded session, and for example, I do shift work. Sometimes the sessions are being carried out when I'm just about to go to work. So my 1 hour during work, for example, I could review the session. So you could record and download these sessions and review them on another date. So that's one of the things I like about the program, or online learning, a lot. Yeah. See if there are any more questions. Another aspect that I like about the program is the fact that there are different. So we have students from different parts of the world, right? Sorry, there's a question here. Super thanks. Have you always been based in Trinidad and Tobago, and what do you hope to gain from the masters? Oh, yes. So I did my studies in Trinidad and Tobago. My undergrad degree was from the University of the West Indies, St. Augustine campus, for 5 years, after which I did a 1-year internship and an elective period in the UK. And I've been working here ever since. So yes, I am totally based here. The masters in critical care, first of all, stem from the fact that after the pandemic, we had a lot of cases. You know, when it started, the presentation, patients presented with different signs and symptoms, and a lot of them ended up, ventilated. So that is what inspired me to, first of all, do the critical care program. And as to the second part of your question, and what do you hope to gain from the masters? Advanced learning in terms of being able to know, first of all, what the rest of the medical community, how the rest of the medical community approaches the management of a critical patient. I hope to change, not really to change, but to evolve our practice locally into standard guidelines and standard practice that could be recognized anywhere internationally as well. So it is, to me, getting into a postgraduate program is important to always advance yourself or evolve, or to make yourself better in terms of patient management. Because as you would, if you're a medical student or if you are in medicine, you will recognize that the guidelines and the management changes too fast. And so being part of the program affords me to learn what are the new guidelines and a better form of management for our patients. Right. Yeah, welcome to everyone who just joined in. If you have any questions, I'll be happy to take them or answer them, or try to answer them if I can. Let me look at it. Thank you. New to Instagram, I suspect. Thank you. New to Instagram. Thanks. On that point, one of the things I noticed in the program is that we do have other healthcare professionals in the program. So we have paramedics, for example, and within the UK system, they do so much, for example, for the patient. So I remember asking one of my colleagues on the discussion board that literally by the time patients are transferred to the hospital, they're already better, because the paramedics have early warning systems to take care of these patients right up to the handover at the emergency room in UK and Europe. Where I am, we're a little bit limited, and that is something I really would like to look into, to really expand on our pre-hospital care, because the pre-hospital care, if the patients are taken care of better, if the pre-hospital management improves, then the chances or the rate of survival when they get to the emergency room also improves. So that was something I found fascinating already in the first 3 weeks of the program, that the other paramedics within the program were able to share with us what they would do on the field right before they before they take the patient or transport the patient to the hospital in the UK and in different parts of Europe. So I found that very interesting, and it's something that I would definitely like to implement where I am to improve on pre-hospital care and management. So yeah. So you mentioned paramedics. What is it like studying with healthcare workers from disciplines, from different disciplines? Oh, it's been fantastic. It's been wonderful, because before I got into medicine, I studied nursing. So I'm also a nurse. So I do understand the nursing role and the medical doctor's role as well, right? But to be able to understand the role of the paramedics further improves my care, because they do have a different approach, or most times actually a similar approach to identifying critical patients. And I remember a discussion we had last week or the week before that on how to assess a critical patient. And the medics had a different way, which was quick, which was reliable, and quick thinking and quick decision making in order to get that patient out of the house, get onto the ambulance, and get the patient to the hospital. So those are little things I would have taken for granted, because here you have paramedics transporting patients in a moving vehicle. Most of the times it's just two of them, and while they are actually administering care or taking care of the patients, they're communicating with the emergency room physicians to give them daily updates about that patient, and sometimes even communicating with the relatives in order to provide good care to the patient. So it broadened my perspective onto the different healthcare professionals, and to really recognize that we may have different roles, but our goal is the same, and that was a take-home point the past 2 weeks. The fact that the paramedics in the program were very vocal about the form of management, why they do what they do, and I was able to absorb that and really and appreciate the fact that they may have a different form of assessment, but it is the same thing, and our common goal is to get the patient better and effectively, administer care. Let me see if there are any more questions from the student. Choose one on the screen. Okay. Are there any more questions? Okay. Thank you guys for being part of the live. If there are no more questions, I will be ending the live. Oh, last one. Do you have any advice for a first-year medical student interested in critical care? That's a very good question. I think I would suggest that for first year medical students, they should not at this moment narrow down their choices unless you are absolutely sure that critical care is what you would want to do in the future. I think being open-minded and allowing your journey through medical school to kind of shape you as to what type of doctor you would want to become. Because just the other day as well, I was thinking, wow, this would be a wonderful time to get into public health, because it is really the public health doctors that are driving the decision making in the country right now. And the critical doctors or the hospital doctors are just responsible for stabilizing patients and making sure that they do not get a bad outcome. So I would say for first year medical students to really enjoy their journey through medical school, have an open mind. If critical medicine is what you're thinking about, when it's time for your electives, do a rotation or an elective in critical medicine, because it does have its very good sides, but it can be very discouraging as well when you have to see a bad outcome for some of your patients. And if you start seeing that too early, I wonder what it might do to some aspiring or a first year medical student. So I would say, keep an open mind, enjoy the medical school process, and allow the medical school journey to shape you. That's what I would say. Thanks for that question. It's a good question, really, really good question. Let me see if there are any more questions on the board. You're welcome. So, thanks for your answers. Okay, guys, thank you guys for coming. I hope you guys have a wonderful day, and I wish you guys the best. Okay, bye-bye. Thank you.